In this video, I'll tell you what to do if you run into trouble or have questions during your recovery at home after total hip or knee replacement. First of all, let's talk about severe symptoms like chest pain, shortness of breath, or headache that you may have when at home. Remember, it is uncommon to develop a heart attack, stroke, or blood clot after a hip or knee replacement, but this can happen. It's important to know if you are having these severe symptoms, particularly worse than you've ever had before, that we want you to call 911 and go to your local emergency room. Beyond these type symptoms, most everything can be handled through your doctor's office. So let's talk about milder symptoms like pain, swelling, redness, and fever. First of all, low-grade fever after a hip or knee replacement is common for several days up to a couple weeks after surgery. A fever over 101.5 Fahrenheit can be consistent with a concerning infection, however. If you have a persistent fever over 101.5, call your surgical team. Pain, swelling, and redness. If these type symptoms are not responding to the multimodal pain approach that has been described, and if swelling and redness do not respond to elevating your extremity for 30 or 60 minutes, or the application of ice to your hip or knee, we ask that you call your surgeon's office for these types of symptoms. Let's talk about appointments after your surgery. Everyone needs an appointment with their surgical team after surgery around 10 to 14 days. This is an important time to examine your incision, talk with you about pain, and your rehabilitation. It can be helpful to have this appointment made prior to your surgery. If you do not have one, however, do call to make this. You also may need to have appointments at 6 weeks, 3 months, 6 months, and 12 months after surgery. Arrange this with your surgical team, and if possible, you can make these appointments online. Now let's talk about medication refills. This is most relevant to pain medications. Narcotic medications and anti-inflammatories will need to be refilled by your surgical team. Give advance notice, especially for narcotic medications, which are controlled substances. We ask that you communicate with the surgical team during the working days, 8 a.m. to 5 p.m. You might consider using the My Health Online portal to help with these refills. Remember, at the end of the day, if you have trouble or questions at home after surgery, we're here for you. We covered severe symptoms, mild symptoms, making appointments, and medication refills. If you have issues with any of these things, of course, call 911 for severe symptoms. Otherwise, communicate with your surgeon's office through phone or My Health Online.